I think most of us treat the bathroom as the most boring room in the house. We just go in, do a job, and get out. We hardly think about it beyond that. But your body is actually sending you a lot of wonderful signals from there all the time about hydration, kidney function, and even your heart health. And most of us have no idea how to read them. But today's guest has spent his entire career reading those signals. He's seen the questions people are too embarrassed to ask, the habits that quietly cause problems years down the line, and the myths just won't die, like the cranberry juice. So, whether you're someone who's never thought twice about any of this, or someone secretly Googling the symptoms in midnight or with any AI tools, this episode is for you. Dr. Shrinivas R P is a urologist with over 2 decades of experience, currently practicing at Manipal Hospitals Whitefield, with expertise in laparoscopic, transplant, and reconstructive urology. I hope I pronounced it right. And with a fellowship from University of Southern California in cancer research. Dr. Srinivas, great to have you here.
Thank you. Thanks for having me. Pleasure to.
Yeah, it's been a long time coming. I must thank Nirav, our common friend who introduced me to you. So great to have you here. I
You.
think today we'll just set the context. Dr. Srinivas will cover a few basic questions that, mythbusters and embarrassing questions that people want to ask. And then we'll speak more about kidney stones, urinary tract infections, and a little bit about the urinary bladder. That should be fine, right?
Sure. Perfect. Let's
Awesome,
go.
awesome. What is one major misconception about a urologist role?
See, urology means, it's basically, urology is actually a misnomer. Urology is a very old terminology. The present terminology is what's called as genitourinary surgery. So, wherein, we deal with the urinary tract problems in all, men and women, young, old. Also, we deal with the genital problems of the men. So, including, sexual function, reproductive function, fertility, and those kind of things. And that also includes problems of urinary leakage in women, which is not treated by a gynecologist, it's treated by a urologist. So that's what actually a present role of a urologist.
What was that word that you mentioned? I couldn't grasp it very clearly. Something you said, geriatric,
Genitourinary surgeon.
genito urinary surgeon.
Urinary.
Oh, okay, got it. That's very interesting. I'm hearing this for the first time too. So thanks.
Yes,
Okay, great.
please. Yes, please.
Yeah, cool. So some of the things I want to quick questions. So these are kind of will be good info for people regarding water, right? How much water do we actually need to drink? Because I see a lot of rules. 8 glasses a day seems to be a myth. What's your recommendation?
See, the thing is, this what is the very common question. Whenever we treat any disease and we send the patient home, before leaving the consultation room, the question they ask and they come across through friends, family, and Google is so many liters per day. So they want to ask. See, the best solution to this is we cannot fix a number. For example, to say a man 4 liters, a woman 3 liters, or a child 2 liters. Nobody can fix that because unless you have a proper kidney disease, there is a fixed number, or a cardiac disease, there's a fixed number. But for a normal healthy man, there's no fixed number because it varies from the duration. Like for example, how much you have been physically active, how you have been active on that particular day, have you done a lot of workout or any physical activity. Plus depends on the weather. If it is a hot, humid weather, your water intake, should be higher. If it's a cold, winter day, or if you're sitting in the AC room, the water requirement changes. Now, then what is the guideline then?
Yeah.
How do we go about this? See, we don't go by the water intake. We go by the urine output. So you must check what is my urine output from morning. How do we, make it more practical? For example, from morning, have I passed good amount of urine? How many times have I visited the washroom? Is it my usual number? Have I not passed at all? One. Second thing is also look at the urine color. From morning, when I passed urine, was it clear like water, or was it more mild yellow tinge is okay. Don't allow it to become dark yellow. So those are the indirect indicators. Now coming to the practical answer, 1.5 to 2 liters is a very good urine output. 1 to 1.5 liters is okay, but preferably is 1.5 to 2 liters. That means the kidney has got sufficient liquid to throw the urine out. It means the entire body has got the water intake, which is because kidney throws out only after it's being used by the entire body. So much urine is coming means your entire body is well hydrated. That's what it means.
Okay, so I have one follow up question on that. You said it based on the number of visits to the bathroom since morning, for example, right?
Yeah.
So if I've gone 3 times versus 5 times, how do I infer that I need to drink more water or not, apart from the urine color?
No, you see, one is the quantity itself. See, for example, is if you're talking you as a person, as an individual person, what happens? You've been used to so many number of times in the last whatever so many years and months. You know how many times you normally visit. So you must just check today have I gone or not. Last few days, what am I doing? Why am I going only twice a day? I used to normally go 6 times a day. So those are the indirect ways to know have a path or not. It is your individual specific because everybody is different. There are two normal healthy people. One person passes 8 to 10 times a day, other person passes only 3 to 4 times in a day. So both are healthy,
Okay.
their bladder capacity is different, their urge is different. Sometimes, passing urine is also part of your mentality. Sometimes, you're more nervous, you go more frequently. You're sitting in the AC room, you go a bit sort of, a bit sort of early, premature, you go. So depends on the state of mind. So many things, factors are there.
Okay. So there is no correlation to the number of times somebody goes. That's not a
No, not,
issue at all.
not, not, not that. That is also one of the things. It's a product of number of times and the amount of urine you pass in one go. So therefore, my normal number of times I have passed so many times. Today, why not pass much at all from morning? Why did I not visit? So therefore, I need to probably hydrate myself. I'm traveling somewhere. I should hydrate myself. It's a reminder. You must watch out compared to your habits.
Got it. Got it. So then that basically that means that if somebody has gone exactly around the number of times that he used to go, then he's sufficiently well hydrated.
Or
That's
yes,
the
exactly, more or less.
okay.
Yes, please.
Got it.
Yes,
Got it.
please.
This really helps. Now you mentioned something about urine color. What does my urine indicate, and what color indicates what? Why should I notice it closely?
See, the thing is, basically there are a lot of things it can indicate. For example, foaming of urine. What are the contents? Any particles? The smell. So many things it can indicate, including the color. People do not notice it because they like what you said. So rightly, you said at the beginning, your opening statement said that we just rush, we come back, we carry phone in our hands, we don't notice how we are passing, we don't see the color, we just flush and come out. We actually should notice. Because many times it's not noticed nowadays with the western toilet, the flush available, we unlike Indian toilet, we would not notice at all, including stools. We should notice how we are passing. It's like self examination. So therefore, the simple crystal clear like water, that is urine, is like a very well hydrated person. You're hydrated at that state, you're very well hydrated. But okay, medium hydration also includes some amount of yellowish colored urine, which is a normal color of urine. Okay, no, mild yellow tinge, amber
Mm-hmm.
colored is what is described as. That's also normal colored urine. But something more darker, a bit reddish tinge, orange tinge, again means there is some problem. You may have to go investigate yourself. Or else, sometimes some particles, or some turbid particles, especially cloudy urine or foamy urine, especially the background of like, a slightly older age group, diabetes, hypertension, smokers.
So I think you mentioned about foaming and reddish or brownish color. Those are the things that are kind of warning signals for them to visit a
Yes,
urologist. Correct.
yes, of course. Yes, please. Yes, please.
Okay, got it. Great. So the third question I have, which is a very common thing, holding pee or urine, is it dangerous or is it uncomfortable or is it okay?
No, not at all. Not at all good. Okay, no. Whenever you get a call, you should attend to it. In fact, which is what we say, especially I'm saying this more early compared to earlier days, this in modern days is more relevant because especially there are especially women especially
Hmm.
who who attend to the offices, who are in the outdoor spaces as much as men nowadays. But the problem is what has not changed, though that has changed, gender parity has come. What has not changed is women do not get comfortable public spaces, to relieve themselves, unlike a man. So therefore, what commonly, especially many software engineers, young ladies, and school teachers who come to us, they say, "Doctor, I do all my safety thick checks in the morning, 10 o'clock. I use the washroom before leaving house, and I come back and use it at 5 o'clock. But even then, I get UTI." The point is exactly the reverse. Just because they're not using their washrooms in their workplace, they're getting into this because you should not postpone urination. The moment you get a call, you should urinate. You should pass. It's better to use a public toilet which has a poorer hygiene than to hold urine inside your body and then go relieve yourself, because there's a seed of one is kidney dysfunction, urinary infection, and more neurological problems with the bladder. In the long term, your bladder will suffer.
Okay, this seems much more serious than what people have thought then, right?
Definitely,
You
definitely,
said
you should not postpone.
okay, you said bladder issues, neurological, what was the other one?
See, the thing is, see, for example, the whole act of urination, no, is It's a complex amalgamation of the nerve signals. It's also an amalgamation of the muscular effort from the bladder. At neurological level also, at muscular level also, our body suffers. It gradually, the body is like a memory. It accumulates the memory. It keeps suffering gradually. The bladder muscles will suffer. They're distant. They become incapable beyond a point. At a young age, they can tolerate all this. All the years of stress, of holding, which is not a physiology. It's not meant to hold so much urine. You've been chronically postponing urination. Chronically, you're distending the bladder. Bladder gets thin. The muscles become weaker. Gradually, it goes into chronic dysfunction. So we shouldn't be subjecting a body to those levels. So therefore, if you see, the combination is, we tell people, even if they're traveling temporarily to a foreign destination or wherever, they must make sure they forget food. They must make sure they hydrate themselves well with water and other liquids, and they use washrooms regularly. If at all they want to use a public toilet, especially women, I'm saying, because men though should do it, no doubt about it. Especially women people who find it difficult to do, they either use V wash or they use what's called as P safe. They make sure they carry things so that they make sure they are comfortable. But whether it's a public toilet or whatever, they should use. That's much better than not using. Not using causes UTI. Using, is a matter of hygiene. How you take care of it is up to you. But yes, you should relieve yourself.
Got it. That's a very, very interesting message for a lot of people. Okay, to the next question. What's one very basic way, apart from urine color that you mentioned, is there anything else a man and a woman can know at home that their urinary function is normal?
See, the thing is, there's also what's called as a litmus test. Normally our urine is very mildly acidic. Okay, our mild is, when we say acidic, as a basic science students, 0 to 7 is acidic, 7 to 14 is, is alkaline pH of urine. So there's something on the litmus paper. The litmus paper, if it's available in any of the common stationery stores also, whenever you dip it in the urine, the color you can make out. If it turns reddish, it's acidic. If it turns bluish, it's alkaline. So normal urine is mild acidic, less than 7, 6 somewhere there, 6.5 pH. So if it's too much alkaline, you will know. So that is also a long term thing. It also makes you prone for UTI. So
Prone for,
all
sorry,
that,
what was that?
sorry,
You
it
said
leads to UTI. It leads to long term
okay.
urinary infections if the pH is kept in the alkaline, side. So that's also a way to know. And other thing that we already discussed now about the urine color and the amount of urine you're passing, and the content, how it's looking. Are there any threads in the urine? Are there any, whitish particles in the urine? How clear? Those are all indirect indicators. And litmus test is one more step, but which anybody can do. It's a easy bedside test. We say you don't have to go to a lab.
Good. And what color would come? Would it turn orange or
Mild red. See, there are only two
mild?
colors. Either it turns blue or it turns red. Red is, is an indicator of acidic urine. Mild acidic urine is a normal urine. That's how the urine should look like.
And how often would you recommend that people do this test at home?
No, they can do it. See, probably they can do it, once a month, or so they can carry this, at home. They can keep it at home. They can do it, at any part of time of the day. But thing is, whenever you eat a meal, especially a plant-based diet, you will see the urine turns alkaline immediately after, after your diet. That's also normal change immediately after diet. It's called as postprandial alkaline diet. It happens because plant-based diet is rich in alkaline food, which is a very good thing for the blood and urine. So blood also turns slightly alkaline. Urine also turns slightly alkaline. But anyway, I don't think you should worry about all that. A
Okay.
general indicator is a mild acidic pH.
Okay. So
Is
once in a
reddish.
while, if people can test it, they'll know the
Yes.
litmus test. Okay.
Yes, please.
Cool. The next question on the quick round. If someone is waking up twice or thrice a night to pee, is that normal part of getting older, or is this a sign that something needs to be fixed?
See, the thing is, like what you said again, it's all about an individual thing, because everything is individualized. So as you said, people growing older also may notice that they are getting up too often in the night and passing urine. That is of course a part of normal aging changes. But again, you can't take it for granted. If it is something new onset, which is not your normal routine, which is a sudden onset, you say, doctor, all this while I've never been getting up. Last 6 months I've been getting up twice at night and all that. Then it means probably it's also an indicator either of a kidney issue, where the kidney dysfunction also can lead to frequent urination, especially at night. Also, it can be an indicator of what's called as a prostate problem, especially in men. As men grow older, they develop this prostate gland problem in the urinary passage, which is a part of aging process. Again, not cancerous, not life threatening. That itself can give rise to these changes. So we need to look up what's happening. And also, you must look up what's your water intake or liquid intake beyond 6 p.m. That is, 3 to 4 hours before bedtime. How is your fluid intake? That is also an indicator.
Got it. So if there is a major shift from the usual baseline, then that's an indication that they should visit. That's
Of
the
course,
message for people.
of course, of course.
Okay, awesome. I think these were excellent, quick inputs for a lot of people, and I also learned quite a lot today. Thank you so much.
Happy.
So I'll move straight away to some topic that you said is one of the most common cases that you see very often. That is kidney stones. We'll spend some time on it. What exactly is a kidney stone, and how does it form?
See, we say kidney stone. No, normally, medical word is called as a calculi or calculus, because it's a solid particle that is produced in the urine. But because for a common man, to make him understand, we use the word stone. Because this stone is just like the stone that you find on the street. It's so hard. It's like not easy to break. Again, depends on the contents. There are minimum 5 or 6 sort of common varieties of kidney stone that can happen in the kidney. So they happen not because of any new chemical that a person is passing in the urine. 99% these are the chemicals which every human being passes in the urine. These are not some unusual chemicals. These are the same chemicals that every human being who's never formed stones, even they pass the same chemicals in the urine. But the people who form stones only are not able to sort of dissolve them in the urine thing. So they're called a super saturation. The urine is super saturated. These chemicals are not able to be dissolved, like in the solute, like the same basic chemistry, solute and solvent. The chemical cannot be dissolved in the solution, so it's not able to. It's getting super saturated, and the chemicals are getting precipitated. The precipitate is in the form of a crystal. It forms a stones. So chronically, gradually, depending on the kind of food that you eat and the amount of water you take, these salts will get accumulated in the kidney. They gradually develop stones. It's all about, one is basically hydration, the kind of food you're eating, and the body nature. Some people also prone, though the same family members, they eat the same food, the same water, everything. One person develops stones, other person doesn't develop stones, because depends on his body's genetic nature. So that's
So you
also a factor.
Okay, so you're saying it's mostly a combination of hydration, diet plus genetics as well.
Yes, yes. The
And
same the same basic question of nature versus nurture. One is how you're born with something, and also nurture, how you take care of it, what environmental factors you're subjected to, how you take care of your body, your water intake, food, and where you live, all those things matter to form stones.
is it harmful?
Of course, it is. See, the moment kidney stone is there, it doesn't mean anything dangerous. Okay, kidney stones are there for many people nowadays because of the modern lifestyle or whatever. A lot of factors are contributing. In fact, if you see last 30, 40 years, if our teachers who speak about all these kidney stones, they say they used to see 1/10 or probably 1/20th of the kidney stone that we are seeing, because our kidney stone incidence has rapidly increased, whether it's because of global warming or contamination in the food or diet, liquid water, we don't know. So the numbers are increasing now. It's becoming like common, like your diabetes and hypertension. The thing is, some amount of kidney stones are okay, it doesn't harm the kidney. But anything beyond certain numbers, blocking a kidney, or it can also harbor infection, so that cause gradual kidney dysfunction. So therefore, kidney stones should be watched very closely and treated whenever required.
And how does anybody know that they have a stone? Is it based on that litmus test or the urine color too?
No, no,
No?
no, no. So
Okay.
once you have to know kidney stone, you must do an ultrasound scan. Ultrasound scan is a basic ultrasound scan, and then followed by CT if required. But ultrasound examination is required. You will not know with pain or any other thing, because by the time you know with pain and other things, it's already too late. It's already a stone which is blocking and troubling you. Most stones are very silent. They're asymptomatic.
So how do I then get to know whether I have it or not? Only by
Health check. Health check. Yes, please. Health
Okay.
check. You must go for a health checkup. Have an ultrasound scan. That's the only way to
Okay.
know.
Interesting. You mentioned about modern lifestyle and food and diet, a little bit of genetics, right? Can you just give us some specific indications of any type of food and diet that is actually contributing to this kind of a change that you mentioned? You said there is almost 8 to 9 times more cases that are coming
Yeah,
as a
yeah.
lifestyle disease. Like, just explain us, give us more knowledge around that.
See, the thing is, what has been found. See, one is I'll tell you first about the most obvious thing. The most obvious thing and the most easily understandable thing is the global warming thing. Overall, if you see, the earth as a whole, we are all experiencing higher temperatures compared to what our forefathers, used to experience. And as an average, very, very much global average, annual average, if you see long period average. So that's probably also contributing. In addition, our water intake, and the kind of water we take, whether the water is very mineral rich, whether groundwater there's a problem, understood, we do not know. And then overall, what amount of water we take is not good enough. And the worst thing is, these moderate drinks, like, like soft drinks. All the soft drinks are rich in oxalate. And stones basically contain oxalate. The calcium oxalate is the one, that is the most commonest stone that we see. Whatever I told you, 5 6 varieties of stones.
Yeah,
The
yeah.
commonest variety, 80% is calcium oxalate. Again, there are sub varieties called as calcium oxalate, monohydrate, dihydrate, but oxalate is the one, and that is commonly found in all our fizz drinks, all our soft drinks. So we say, when it comes to kidney stones, soft drinks are worse than alcohol.
Okay.
So that way, yes, yes. So
That's
and
interesting.
of course, yeah, of course, water intake also contributes. So if you hydrate yourself well, like, most of your sort of toxins and your sins are clear, are taken care by water. It can compensate to an extent, but yes, there's also role of diet. Diet. When we talk about diet, see, the logic behind diet is, again, diet is a topic, as far as kidney stones are concerned, is very, very sort of confusing topic, very controversial. When it comes to kidney stones, patients are confused. See, the commonest confusion stems from, one is, their friends, family, internet, and even some old doctors also used to say this, that, don't take tomato, don't take spinach. A lot of things are there. If you see, actually, the moment you open the net, you'll find this. Actually, without any of these, tomato and so many spinach, you cannot, as for example, see, temporarily for 3 months, 6 months, you can quit them. How long can you quit them? You can't quit them forever, because you belong to the earth. You need to eat this food that comes from the earth, so you cannot avoid them. Only thing is, what is logical here is, take, see, moderation is the key. Don't take excess of any of this. So therefore, ultimately, the solution is, see, how the whole logic works. We were talking about the pH just now. No,
Yeah.
kidney stones form in acidic pH, which is very extreme acidic pH. Mild alkaline pH will prevent kidney stones. So therefore, all plant based diet is rich in alkaline content.
Yeah.
All animal based diet is rich in acidic content. So therefore, reduce animal based diet, take more of plant based diet. Especially in plant based diet, we ask people to take lots of raw fruits and raw vegetable. Plenty of fruits, plenty of vegetables. But here again, stress is, don't take a single fruit or a single vegetable in excess quantity, or don't skip a single vegetable or single fruit, because nature itself has a balance. You try to sort of take all the kind of fruits, all kind of vegetables over a period of 1 week or 2 weeks. You cycle them so that everything is included in your diet. On a single day, you can't take all fruits and vegetables. So therefore, you must cycle them.
So this is to maintain that alkaline balance that you
Yes,
spoke about.
exactly, exactly, exactly. So if you maintain that alkaline pH, stone formation is totally discouraged. And yeah, basically, and other aspect of diet also you should take care of. You should take mainly water rich food. There are many foods which you take, especially off the shelf. They're all water deficient, which are all stored for long time,
Yeah, yeah.
packaged diet. They're water deficient. So whatever is comes fresh from the earth, they're all water rich.
Got it.
So
Got
you
it.
must focus on such things. Yeah.
So the other thing I want to understand, Dr. Srinivas, is this stone. Typically, when people come to you, and who comes to you more? Is it men or women who gets affected more in kidney
Both,
stone?
both, both,
That's
both,
almost equal.
almost equal, maybe slightly higher incidence in men, but otherwise almost equal.
Almost equal.
Yeah,
So
yeah.
do they? Does it, like, when you inspect them, do this ultrasound scan or CT? Do you see multiple stones? Do you see one big stone? Like, how does it usually form in these people when they come to you?
No,
And
see,
what is
no,
their
no,
age
no.
profile also?
Yeah, is usually the middle age, middle age or adult, like uh probably in their 20s, 30s, and 40s. This is the commonest age.
20 to
Okay, no,
40.
if I 20s to 40 is a very common age. Whenever we slightly see in the older age group, they're called as high risk group, because that's not a common age group. Whenever we see in younger boys and girls, again it's called high risk group, because we don't commonly find in them. And if we find in them, the implications are higher. So therefore, we have to investigate them one a bit more in detail. Otherwise, the common age group is this only, and there also, like what you rightly asked, commonest thing we find is a single stone, or a stone which is generally less than 5 millimeter, 3 4 millimeter. One of them. See, some of them come with a blockage with pain, and some of them come after health checkup. Health checkup said there is a stone, they come here for an opinion. So, or a family history, or past treatment history. He's had a stone in the past, treated. Now he's had a follow up checkup. So that's how they come.
Got
And
it.
yeah,
So one use case is when they did a health checkup as part of their regular annual checkup, they figured out that there was a stone. They came kind of preemptive way to get it cured in
yes,
some form.
yes, yes.
The people who have it, what does it actually feel like for a person who has kidney stone? Let's say I have a 2 millimeter kidney stone. What's going to happen to me?
Nothing actually. You know what? Interestingly, people having stones and people do not having stones, you cannot make out any difference. I'm saying externally or internally, both ways. We as a doctor or the patient himself cannot make out any difference whatsoever unless a stone comes and blocks. Because the kidney, but when you talk about urinary system, there are two parts. One is like a big room, a roomy area called as a pelvis and the calyx. Stone sitting in the roomy area will not cause any problem. But there is one highway called as ureter, where urine is flowing through a very tiny space, which is a main road. If the stone comes and blocks the main road, causes severe pain. Even the smallest stone, see, the interesting thing is, even a person with a 3 or 4 millimeter stone causes severe pain. He cannot sit at home. He keeps juggling between hospital and house because of injection, then goes back home because we don't operate for very small stones unless the pain is, really intolerable. And the other extreme is there are people who are blissfully ignorant. 20 millimeter, 25 millimeter, which is almost 2 centimeter stone sitting in the kidney corner. They're shocked when they see in the thing because it is sitting in the roomy area of the kidney. It doesn't block, that doesn't cause. They say, doctor, how come I'm so comfortable and you say like this? That's how it is. So the stone size is not very relevant. The more relevant thing is, whether it's blocking and what are the other antecedent precedent causes, which is, which brought the patient to the hospital.
Okay, so if it's not causing me pain, should I bother or not bother? I should still come to you to get it treated. If it's in the
Yeah,
big
yeah,
pelvis and big room
you
and not,
sh-
not causing any trouble.
you should. You know what? Interestingly, the big stone which is sitting in the roomy area of the kidney, it causes gradual kidney dysfunction because of there are a lot of bacteria sitting on the stones. See, bacteria cannot easily sit on a live tissue. For example, if you see an ordinary table surface, bacteria sitting there, and your hand, the stone the bacteria sitting on your hand is subject to regular scrutiny. Your body defense will take care of them. Say like that on a live tissue, they can't sit. Then the moment there are stones sitting in the kidney, it's a hotbed of bacteria. A lot of bacteria sitting on them. So they will gradually, they're called as urea splitting bacteria. These are very toxic bacteria. They gradually cause kidney dysfunction. So stone sitting in the corner. Many people also this, there are people, you'll be surprised, people who are very comfortable, very well off, had multiple health checkups. People have been diagnosed with stones and they don't undergo treatment because they require surgical thing. So they postpone it for years together because of fear. And the stone gradually causes kidney dysfunction. So that you should not, allow. There's no medical treatment because such a big stone, no, the surgical treatment was the only option available. And
And
they're silent stones. So you should not
this
postpone such cases.
this stone and the bacteria sitting on the stone, like how do they cause kidney dysfunction? What do they eat? Do they eat the nerves, nephrons, whatever they call it? Like what happens inside
Yes,
the kidney?
exactly. See, by being gradually there in the urinary system, it causes nephron loss. See, the simple thing, the stone, and what is the importance of stone? The size doesn't matter. I told location matters, and size matters when it's sitting in the corner. So therefore, whenever a stone is sitting there in the urinary passage, the real thing for us is the nephron loss, the rate of nephron loss. The longer the stone sits, the rate of nephron loss is higher. The bigger stone sitting there cause nephron loss higher. Either it should be sitting in the crucial part or it should be sitting in a big roomy area. Both extremes are not good for the body. So it can cause gradual nephron loss.
So eventually,
So
is there any timeline, like for example, 2 years, 3 years, or it can happen at any rate of
it can happen,
progression?
it can happen rapidly. So even there is a big spectrum in the kidney stones also. Some people are called as rapid stone formers. You remove them today, CT confirmed that the whole stone is cleared. Within 6 months, they form multiple stones. There are
Oh,
some people who form stones only once in the lifetime. You have a stone removed now, 20, 30 years, even they forgot, you forgot, they come out 20 years, you do a scan, no stone is there. So, so there are extremes of patients. Understood? There are some people who form stones very, very slowly. There are some people who form stones very rapidly. So we can categorize the patient, risk categorize only on multiple follow-ups. Once they come for 2, 3 follow-ups, we know, okay, this person forms stones at this rate.
Got it.
Therefore, warning signals and things are according to that.
So out of this 5, 6 different types of stone that you mentioned, you said oxalate is the most common one, calcium
Yes.
oxalate. The other
Yeah.
ones names I don't know, but is there
See,
anything
yeah,
that
tell
says
me.
that this is the most dangerous type of stone that needs immediate attention? Anything like that out of these 5, 6
See,
varieties?
yes, there is what I told, we were talking about stones which are large sitting in the room area and all that, which will not cause pain. Yes, they are called as true white stones. There's a almost, we can say, fourth or fifth common variety of stones. So they are the ones which supports bacteria, or rather bacteria supports and bacteria helps prepare stones in this form. That's why they're called as urea splitting bacteria. The urea is a or a normal component in the urine. So bacteria knows to split the urea so that they want to survive for themselves. At the same time, this urea splitting bacteria produces these kind of chemicals, which accumulate on the, so they rapidly accumulate and they form these stones. So the urea splitting bacteria does this, so it's a combination of these bacteria and the stones. Very bad combination.
Okay, that's quite dangerous. One last question on the kidney stones. Let's say people have one of these stones and they came to you. What is the typical treatment? How does it look like, and how long does it take to cure a person of this nature?
So the same way what we categorize right now, like one is small stone sitting in the kidney corner. We just follow up, we just wait and watch, because the patient has come from a health checkup, not a big stone. So only follow up is required. We talk about dietary modifications. There are some medications which prevent stones, from becoming big. So we follow those interventions, and also we ask them to do a very regular checkup every 3 months. Initially ultrasound to risk stratify them, and later probably gradually make it once a year. Okay, that's how we do it. And then this is about risk stratification based on the small stones. Follow up. There are some patients who come with a stone blockage. Again, the stone blockage we wait maximum for a period of 1 week. If the stone is passing out naturally, nothing more to be done. But if the stone is not passing out naturally, we must do what's called as ureteroscopy or endoscopy. Through urine passage, we put the scope and we remove the stones. No, but we wait. Sometimes the stone size also is a criteria. Even for small stones, we wait for a week. There are some stones which are big, which are picked up incidentally on health checkup. There, again, we counsel them for a surgery at their earliest convenience, but not emergency, but better not to postpone, because these are again hotbed of infection, and kidney dysfunction mechanism. So there are those stones category also.
Got it. Okay, so usually it's like a wait and watch or a surgery using
Yes,
what do you
yes,
say? It
yes.
is called what scopy is it?
Ureteroscopy. See, whenever we put
Ureteroscopy.
any instruments through the body orifices, like from mouth is called as OGD, upper G endoscopy. Through urine passage is called as ureteroscopy. Through urine passage we do that and we remove the stone.
Got it. Got it. Great. I think it's a great primer on kidney stones. I think a lot of people who either want to avoid it or who have it, they know what needs to be done. I also learned quite a lot about kidney stones, calcification, oxalate, and other forms. Thank you so much. Uh, Doctor, I think we'll now move into another very common infection that people face.